My name is Betty F. Adams. I am the Director of the Juvenile Forensic Services for Children. I have been with the agency for 42 years providing services in the juvenile population. One of the forensic programs, which is the Triad mental health program. This program is comprised of 5 licensed clinicians. The philosophy of the program is family-centered focus, and the services are focused around the family. The goal is to prevent the kid from being removed from the home.
Our services are offered to youth and families that are either dealing with family conflict, substance use, acute behavioral health issues, or mental health, trauma, transitioning, grief. And so there's a multitude of things that we offer or tackle when families come into or are referred to our services. At Triad, we also have a Waco Center for Youth Liaison that is housed with our team, and they're responsible for coordinating the transition of a youth that perhaps presents with acute behavioral issues or emotional disorders. And the Waco Center for Youth is a long-term psychiatric residential facility, and it services youth from 13 to 17. Once the youth is there, and if they are discharged, our liaison can actually help with their aftercare as well, and help the family either determine if they want to transition to the Harris Center for additional support and services.
The therapists that work closely with these families always tell me that flexibility, creativity is the success to getting these families to where they need to be. The 5 clinicians are divided up into 2 teams. One team is a Triad mental health. There's 3 workers there. And then the other team's divided up into 2, which is the Common Sense Parenting.
Common Sense Parenting is a preventative program that was designed to help parents with behavioral problems that their children are exhibiting, ages 10 to 17. We are also working on not just getting the parents to learn techniques and strategies on how to deal with this, but we also work with their children in helping them talk to the parents in a way that's more successful, and we stabilize the family setting again.
A lot of families may be worried about not having insurance or worried about the cost, and being they're one of the biggest counties in Texas, that is one of the great benefits that this service is at no cost for families, but also that we work with so many other agencies within the community that families have an opportunity to be connected to us even if they are not aware of our services.
Having this program has been, for me, a great access to the families, and that's because these clinicians work closely with the families and the youth to prevent them from being removed from the home. That is the key. We're trying to keep these kids in the home. We're trying to help the parents develop parenting skills to work with these kids and to teach these kids how to utilize skills to help them recognize symptoms of anger or depression that's coming along, and be able to notify somebody and talk to somebody about the symptoms instead of acting out in a negative way.